how's it going?
It's going good.
Whose chart is that?
Oh, it's my aunt's. I wanted to see her lab work. She was admitted last night and I'm a little worried about her, so I was gonna check on her.
Oh, I see. Okay. Well, I'm just really sorry to hear about your aunt. Tell me a little bit about what you've learned so far about HIPAA.
Well, we've talked a lot about it in class and in onboarding, but I guess it didn't really seem like an issue to me because I'm part of the healthcare team here, so I figured it was okay.
I see. Okay. So the HIPAA privacy rule does provide federal protections against access to personal health information. You need to have a valid reason to access somebody's chart and somebody's health information. And unfortunately, your aunt asking you or you being concerned about your aunt does not qualify as a valid reason.
I guess that makes sense. If I'm not taking care of her directly, it's probably not my business to look at her charts.
That's right. That's exactly right. So, what do you think could happen?
I guess, well, it's an invasion of her privacy, so maybe the hospital could get in trouble, and I could probably also get in trouble with my school.
That's exactly right, yeah. So the hospital could be fined. You could get in trouble with your school, like you said. You could fail clinical, for example. It depends on your school's policies.
Okay.
You could even be contacted by the board of nursing or fined by the board of nursing as well.
Okay. Yeah, that wouldn't be good.
No, I wouldn't want that to happen to you. So, what do you think you could do next time if a family member or a friend wants you to look stuff up or you're worried about somebody?
Well, if a family member asked me, I could just say, I know that I work here, but since I'm not directly taking care of that patient, it's against HIPAA violations. Just respectfully say that to them because...
Perfect. Yeah, just let them know that to protect them and to protect you, that you can't do that. It's against the law.
Yeah.
So I think this is a really good learning opportunity. Let's make sure to talk about this in our post-clinical, and we'll make sure to bring it to everybody in the group so everybody's on the same page about HIPAA.
Okay. Yeah, that sounds good. I'm sorry.
That's okay. It's a learning opportunity.
Oh my goodness, did you see her blood pressure? I don't think she's taking her meds.
Yeah, and Dr. Dula drew labs on her, but I don't even think she'll hear back about the results.
Really?
Yeah.
Oh my goodness.
Hi, students.
Oh, hi.
Hi. How's it going?
Good.
Good. Do you think this is the right place and time to be having this conversation?
Well, we just came out of her room and we were really worried about her, so I guess we didn't really think about that.
Okay. Well, I appreciate that you're thinking about your patient and worrying about them. But this is not the place and time to be having this conversation. What do you think are some risks about having this conversation in a hallway like this?
Maybe some patients or visitors or family members could walk by in here.
That's right, exactly. And what do you think, what if her family members came through, for example? What do you think they would think if they heard you speaking like this?
They would probably be pretty disappointed. They'd feel like it's really unprofessional, and if it was me, I'd be pretty upset.
Yeah, I think I would be as well. In addition to that, this is a potential HIPAA violation because anybody can walk by, housekeeping, physicians, anybody can walk by and hear you talking about a patient's personal private information. So where do you think would be a better place to have this conversation?
Maybe a private area with the door closed. Maybe the nurse's station, but next time I need to talk to a nurse, I'll make sure I do it in a safe area.
I'll just be more aware of our surroundings and make sure we're doing it privately.
We'll be more careful.
I appreciate that. Thank you so much.
Thank you.
you.